Great stuff. Well, let's move on. And Dr. Cole, boy, there's an epidemic now in youth sports. I can think of a number of things, but you think about concussions, and we see it in the NFL week after week. But I know you folks at Midwest Orthopaedics at Rush are trying to take this to another level, right?
Steve, it's been long overdue. There really has not been an identified concussion program in Chicago where I trained. I trained at the University of Pittsburgh, which established a program years ago. There's maybe one or two other programs in the entire country. And given our affiliations with colleges, with youth sports, and with professional sports at Midwest Orthopaedics at Rush, we have honestly we're late to the game mainly because we haven't been able to find the proper person to help lead a program. Our primary care sports specialist will see patients with concussions on a regular basis, but to do it right, it requires a comprehensive integrated program that doesn't involve only a traditional sports medicine physician, but you have to have a neuropsychologist. You need to have access to potentially even higher level care such as neurosurgery, which is very rare, specialized physical therapy, which is a really big component to getting back after concussion. And I'm proud to say that we're launching a broad-reaching concussion program that I think with our leadership that's coming in and with our affiliation with Rush, that will be the biggest and best concussion program in the country. So this is one of the things that I've had a mission. Kathy Weber and I, who you know Kathy, who helps take care of the White Sox and the Bulls as primary care sports. This is a vision she and I have had for years, but we just have not identified the right person for leadership until now.
Well, you brought on a physician here with tremendous credentials. Let me introduce Dr. Elizabeth Pieroth. She has been involved in the assessment of players in the NHL since 1997, head injury concussion specialist for the Bears, Blackhawks, White Sox, Fire, and the National Women's Soccer League, as well as numerous colleges and high schools across the state of Illinois. I love this one, too. Dr. Pieroth, the co-director of the NFL Neuropsychology Consulting Program. She's now the director of the Concussion Program at Midwest Orthopaedics at Rush. Dr. Piroff, thanks so much for joining us here on Sports Medicine Weekly. I know there's a lack of evidence for the need for rest after concussions. How does this create a new paradigm shift on treatment?
Thanks for having me. I'm excited to be talking about this. This is probably the thing that I really want to stress to people, is that one of the biggest misunderstanding about concussion treatment is that you're supposed to rest. The research really tells us that the first day or two, people should take it easy. They should dial it back, listen to their bodies. But the research tells us that beyond the first couple days, we want to start encouraging re-engagement, start returning to school, returning to work, and returning to activity, including physical exertion. It doesn't mean we send people back to play or we send them back to their full activities without accommodation. We really need to be listening to people's symptoms, and instead of talking about rest, talk about symptom management. Because what we have found is that the sooner we get people back to activity, they actually recover quicker. And those who are limiting themselves and laying in dark rooms and not going to school or work actually take longer to recover. So the paradigm has really shifted, and we really need to start focusing on how do we not only just assess concussions, but how do we treat them and so that people recover as expected.
Dr. Piroth, you know, this will be a little bit of a learning point for patients as we move forward, because you're right. The premise has always been to sort of shut them down and until they feel better. And that's not what we do. For example, when I have a Bulls player, for example, that's a whole different thing, but they're in a system, and we have you to turn to say, hey, what should we do when we're in this situation? But go to the public who has children, for example, who get concussions. What are we going to do to get the word out and to help them? Do you think that most of our young people who get legitimate concussions will have to get into some programming initially to help them get back, even if it's just basic guidance? I know it's not a one-size-fits-all, but it would seem to me that given the complexity of this, that if someone has a concussion, they should be seen by a qualified physician. That's one of the reasons why I think we think this program is so important, because frankly, there's just not enough resources, and people are sort of flying by the seat of their pants and often doing the wrong thing.
Oh, I couldn't agree more. And so, I always tell people it's not that, physicians are really just trying to keep up with the literature, which is really evolving quickly when regards to concussion. And they're also dealing with a number of other issues. So there's been a number of studies that have looked at treatment when seen by a concussion specialist. And what has consistently been found is that those individuals who are seen by people who specialize in concussion actually get better sooner. And it's not that we have some special fairy dust we sprinkle on people, but it's the notion that we are addressing those concerns, we're educating people, we're setting up accommodations at school or the workplace, and encouraging people to get back to their work and school and other activities sooner, which actually aids recovery. And you bring up a really important point when it comes to talking about the Bulls, as well as the other professional teams I work with. We actually start low-level exertion early on for a couple of reasons. Is that one, the research has told us that people actually improve when we start to move them. Plus, people who are used to moving, like athletes, actually will start to have some symptoms if you shut them down. So just starting them with even some low-level activity helps mood, helps sleep, can actually reduce some of the symptoms. So again, it's really been turned on its ear as far as how we are approaching those injuries. And we have to really make sure that all providers are speaking the same language, that we're all talking about evidence-based treatment. And that's one of the goals for the Midwest Orthopaedics at Rush and the Rush program, is making sure that anyone who comes into our program is getting the most up-to-date information about how we actually treat concussions. We really need to focus on treating concussions, that there are many approaches that can actually alleviate the symptoms that people are feeling.
Again, you're listening to Sports Medicine Weekly on this Saturday morning. Steve Cashel and Dr. Brian Cole. We're talking with Dr. Elizabeth Pieroth, the new director of the Concussion Program at Midwest Orthopaedics at Rush, talking about concussion treatment. I had one more question for you, Doc, before we let you go. What kind of assessment is done if symptoms are persisting in concussions?
It's a great question, because one of the things I really, again, want to emphasize to people is if your symptoms are persisting, get in to see a specialist, because what we do is we do a very thorough understanding of what is causing the symptoms. So, as an example, we see a lot of persistent symptoms that are actually driven by an underlying cervical injury, an underlying neck injury. Obviously, when someone hits their head, there is some movement of the head and neck. And what we can see is people can have headaches and dizziness and other symptoms that are actually caused by neck injury that can be untreated because everyone's focusing on the concussion. We also see a lot of vestibular issues that can cause balance, that can cause ocular changes, headaches, a lot of symptoms that can be treated through therapy. But we want to make sure that we're monitoring the normal progression, normal recovery of symptoms, and then getting people to the right types of therapists, right types of providers to address those symptoms.
All righty, great stuff. Well, congratulations, Dr. Piroff, on your new appointment. And
Thank you.
This is right up everybody's alley. I've got 2 kids who play youth sports and, fortunately have stayed away from the concussions, but it's a scary situation for so many people, young and old. So thanks so much for sharing your expertise with us. We wish you the best at MOR.
Thank you so much.
All right. Let's take a break, come back with our staple of the show. It's our Ask the Doctor segment. Got some great questions for Dr. Cole to answer. We'll tell you how you can get involved in our segment week by week. Stay with us. You're listening to Sports Medicine Weekly only on
670 The Score.